This Sunday on Press Pass, the uncertainty continues over when Insight hospitals in Trumbull County will reopen. Earlier this month, we caught up with Senator Bernie Moreno at the Canfield Fair, who said he expected the Insight hospitals in the county to reopen in the next 30 days. Meanwhile, after numerous attempts to clarify how Insight patients can receive their medical records, they have provided an update on what to do. Medical records requests are available 3 ways: by phone, email, and fax. So here with more on everything that's happening, the founder and CEO of Insight Health, Dr. Jawad Shah. Dr. Shah, thank you for taking the time.
Thanks for inviting me.
Of course. So, since these hospitals here in the area shut down back in March, have you been hearing a lot from the patients who are confused over what to do about their medical records?
We have heard from patients at times requests for medical records and so on. So we have heard from them, and we've tried to accommodate all of their requests. Some of the medical records, the issues related to that are they're still held under steward. So our staff literally has gone into the hospitals, burnt discs, delivered them to families and patients and so on. So everything we possibly can do, we have been doing our best to do it.
So how easy is it for patients to now obtain their medical records, and have a lot of them gotten them already?
Yes, yeah, the vast majority of patients. I haven't heard any problems, any significant volume of problems. Of course, there are some people that have had some difficulty, but everything we can do and the systems we have in place from phone, fax, email, all of that's structured so that they can put their requests in, and then we try and get them to them. Those that are still belonging to the steward, people, we still try and get those records and then get them over to the patients while we're not necessarily the holder of those records.
So what can people do again to obtain these records, and how quickly can they expect to get them?
They should be able to get them very quickly, within a couple of days, really, of their request, or at least an explanation as to why we're not able to do it if they are not held within us, if the records from the years that Steward was running the hospitals. But I think within a couple of days, within 48 hours, they should hear back, and the records should in fact be delivered. But if there's a problem, they should be told that this is the issue, or this is why those records aren't available.
When it comes to reopening the hospitals in Trumbull County, how are the reopening talks and procedures going at this point?
They're going very well. I'm really very excited by the support that we've received from the variety of government officials and regulators and so on. So we're very, very close now to being able to fully reopen. So things have been going very well.
What kind of progress have you been making to make sure it's open soon?
We're working every single day, and our teams are in place. We've done the facility work that's necessary, since it hasn't been fully operational for several months. We've installed software, which is one of the critical back elements of the hospital, where we can do the intake for the patients, enter the medical records, and all of this is being done outside of the Steward facility. So the idea of transitioning all of these things usually takes around 18 or 19 months, but to say that we've been able to do it within within 6 months, we're very excited. So the idea that all those systems are now internally in place, so that now we can actually accommodate and see patients. Of course, now the issue is personnel, make sure that we have all the right personnel in place and so on, the operational systems. But again, the facility and so on has been well taken care of.
What would it take to get the hospitals fully staffed and operational again, since it's been months since the initial closure, and many have moved on to other jobs?
Yeah, that is very concerning to us, because we do need the staff. At the end of the day, the staff is the most critical and important part of any functioning hospital. And so we're concerned about the numbers and the specialties and the availability of the expertise of the different staff members, all the way from EVS to nurses, physicians, and so on. At the same time, we also have to be very intentional about how we reopen, in the sense that we are unable to build the entire or open the entire hospital as it was functioning from day one. We have to build towards that. So we would bring staff in that's available and necessary as each element of the hospital starts to reopen.
What about the lawmakers like Senator Moreno who have vowed to look into this? What have you heard from them? And are you working with any of them in any ways?
Senator Marino, in particular, has been extraordinarily helpful. He's very concerned about the hospital. It's something that he very much wants to see up and functioning properly. At the same time, he's taken the time to understand the intricate problems and details of what's led to the problem, and then he's been very helpful both publicly and behind the scenes to help move the needle. So we got to where we are today. I don't believe without the help of the senator, the county, the local government. I don't think the state. I just don't think that this would have come to fruition. There's been very significant help we've received in terms of back end regulatory issues and so on that were done, and so yes, they've continued to be helpful and have pushed us to this point now that we're able to, as I can say, stand before you now and say that we're on the verge of reopening.
And looking ahead, do you have more meetings or talks planned with the commissioners or in Trumbull?
We're always available to speak to them. They've also been extremely supportive and understanding, and we do need their help, and we're always available. There's not an official meeting that's planned with them at this point in time.
Do you have a firm date set for when you'll reopen the doors to these hospitals?
We are internally, just trying to decide on the actual absolute firm date, but I will tell you it's within weeks.
All righty, Dr. Jawad Shah, thank you so much again for joining me.
Thank you very much.
All right.